Okay, this is the third video for the digestive system and the last one. We are on slide 102 with diverticular disease. We're talking about a disease that causes sac-like pouches of mucosa and the sublayers of it, uh, and in the muscles of the sigmoid colon as well. Usually, it is we have two forms. We have diverticulosis, which is the asymptomatic form, and then we have the litis, which is obviously the inflammatory form. We can talk about refined food being a major cause of the increase and the prevalence of the disease. It can occur anywhere in the GI tract, and of course, diet changes. The content of your diet will change the location. You do not need to learn and memorize what changes to diet will change the location in the system. I'm not going to ask about that. The etiology is unknown. It is clear that there is increased internal pressure that causes the creation of the pouches. Predisposed locations, meaning weaker biological anatomical areas, are predisposed to the occurrence of those pouching, um, and usually they are also have immediate blood supply. We see that circular muscles thicken while the longitudinal are shortened. Um, we have the disposition of collagen and elastin, leading to increased pressure and herniation. We have the narrowing of the lumen that provokes an immune response. We see that bacteria, as we know, take advantage of this situation, causing an infection, leading to ischemia, and making the situation worse. You see that symptoms can be either vague or absent, but might include cramping pain, diarrhea, constipation, bleeding, distension, abscesses, fever, leukocytosis, tenderness, and in the lower left quadrant. Um, the same list that we've seen before because it's the same mechanisms and the same tricks. So nothing new, truly. Appendicitis, um, you can see that it is the inflammation of the veriform appendix. Uh, there are multiple mechanisms that are offered causing them. None can be agreed upon, so it's probably, because it's multifactorial. We can see that an obstruction combined with elevated pressure and infection are the most common mechanisms offered. Increased secretion, decreased drainage, and narrowing of the lumen, of course, once again, elevate the internal mechanical pressure, leading to tissue injury. So I hope you see that the mechanisms are reoccurring all the time. The mechanical pressure is pushing uh, or pressing upon blood vessels, narrowing the blood vessels, leading to hypoxia. Hypoxia causes the ulcers, herniation, and infection. Then thrombosis might lead to gangrene, um, leading to perforation. Once again, symptoms include pain, obviously nausea, vomiting, anorexia, fever, diarrhea, constipation, peritonitis, and abscesses. So most of them are the same. The system is the same. Then we can talk about irritable bowel syndrome, or it's a syndrome. It's not a disease. It's a functional GA GI, disorder with no anatomical or chemical changes as the cause of the disease, and includes reoccurring of abdominal pain and discomfort due to bowel movements. Main symptoms are diarrhea and constipation. Um, it increases the chances of anxiety, depression, and chronic fatigue syndrome, mostly because of social reasons. Um, it affects in an extensive way uh, the quality of life, and it is expensive to treat. So a lot of people can't afford the treatment. You can see that additional symptoms include passing of gas and bloating, and that is enough for people to not want to be seen in public. Uh, Obviously, they might be ashamed or embarrassed to do so. Okay, disorders of nutrition, starting with anorexia nervosa. Obviously, the loss of appetite, and you see that there's a neural component to it. So it's a psychological and physiological syndrome. Characteristics include fear of becoming obese in face of weight loss. So fear is psychological. Disordered body image is psychological. 15% lower body weight compared to age and gender percentiles. That's one of the ways to diagnose it. Absence of 3 monthly periods in a row, obviously in women, and this women are the major population for this disease, for this syndrome. Complete denial of their condition, psychological. Exercise at extreme and unhealthy levels are engaged to further lose weight. Obviously, they are uh, um, exercising way more than they should beyond the healthy levels because they think that they need to lose weight, and that's not necessarily so. We see metabolic and structural disorders and imbalance, edema, bradycardia, hypothermia because they're losing body fat percentage, constipation, sleep disorders, which could be psychological, starvation induced cardiac failure, and death are possible outcomes. Then we have bulimia nervosa, which is, in a way, a very limited way. The other part of the scale is the psychological disorder that causes extensive eating and binging beyond normal. Then the binging is followed by self-induced vomiting or purging of the intestines because they also usually have anorexia nervosa, um, and they might be both. So they have two serious psychological disorders at the same time. One, the need to eat a lot and then release themselves of what they ate in order to not gain weight. Um, and then they have reoccurring cycles of these behaviors. Notice that contrary to anorexia nervosa, with bulimia nervosa, your weight actually might be normal. Um, After all, because you're eating, but you're also vomiting it. Um, they tend to hide this behavior from anyone that they're afraid that is going to judge them, and we all know as people that we don't like being judged. Of course, the acidic content of the vomiting causes teeth to become pitted and causes inflammation. Obviously, it's going to affect the tissues on the way. Any laxatives can cause internal injuries and bleeding to the organs of the digestive system. Social isolation leads to depression, um, which, in a vicious cycle causes them to hide themselves. Um, We know that when we're depressed, we tend to eat what we call comfort food, which in this case worsens their bulimia, and once again tightening the cycle. Notice that contrary to people with anorexia nervosa, people with bulimia don't necessarily need to be hospitalized. Um, so that doesn't happen much, and that is worse in our ability to help them and find out what's going on. Then we can talk about digestion, accessory organ disorders. Um, you'll notice that a lot of these disorders are life threatening and can be horrible when they happen. Um, and we tend to not notice that because we focus more on the cardiorespiratory system. So we can include in these the liver, the gallbladder, and the pancreas. Um, of course, these organs are cardinal for food digestion and metabolism. We'll start with one of the major ones, which is pretty easy to understand. We're talking about hypertension, not a new area of knowledge to you, but we're talking about portal hypertension. So simply defined as the high blood pressure of the portal venous system. You see that under normal conditions, blood pressure is 3 millimeters. Um, and when abnormal, it's above 10. Um, anything that will obstruct or impair blood flow, uh, increase blood pressure of the veins, will cause this condition. Um, an internal cause is usually the remodeling of the shunts, and thrombosis, inflammation, and fibrosis are also internal causes of the situation. The external causes uh, um, include external vein thrombosis, meaning outside of the system, cardiac disorders, usually of the right ventricle, because we're connecting more to the venous system than anything else. Um, elevated blood pressure leads to blood pooling in the veins and the portal system. Cirrhosis, which we will talk about shortly, of the liver with scarring, is the most dominant cause of portal hypertension. You know that with scarring, we lose the abilities and the normal characteristics of tissues that definitely lead to elevated blood pressure because they're losing their elasticity. Chronic portal hypertension is deadly and hard to treat, meaning that we'll probably have a high prevalence of death. Um, they may include varices, pneumyalgia, ascites. We're going to talk about all of them. Hepatic encephalopathy, um, hepatopulmonary syndrome, as causes of portal hypertension. Uh, when we talk about varices, um, we're talking about the distended tertius collateral veins. The elevated pressure results in collateral veins opening between the portal vein and the systemic veins, meaning there's a shift of blood supply within the system in an abnormal way. Okay, so when you say opening, you have to create them and you have to allow blood to flow to a different direction, and that does not work well for the system. Um, then they transform into varices, especially in the medusa head and rectum. Um, if they rupture, they are, of course, life threatening because of the hemorrhage. Splenomegaly is the enlargement of the spleen due to splenic of the splenic vein, elevated pressure. So that is one of the branches of the portal vein. So again, elevated pressure leads to a pathology. The most common symptom of congestive pneumomyelitis is thrombocytopenia. You can see that it has an immune background and hormonal imbalance as well. Both are complications of liver disease and portal hypertension. You see that a pathological vasoactive cascade causes these conditions, leading to tissue injury due to increased mechanical pressure. So it's the same idea again and again. And you can see that a person at first may be asymptomatic until it's too late. Possible symptoms may include dyspnea, cyanosis, and clubbing, which we've seen before. In regards to the respiratory system, you see that symptoms may also include bleeding, vomiting, anemia, if due to chronic bleeding, elevated venous pressure, and death. And you can see that, and this is an important bullet showing you how horrible the chances is. A person can have up to 60% chance of death due to a single occurrence, and death within a year if reoccurring. So this is highly deadly. Ascites is the accumulation of fluid in the peritoneal cavity. Obviously, fluids cannot be condensed. Pressure is going to go up. And of course, if you have fluids that are captivated in an area, then they're not helping the system. The fluids cannot escape. Volume of fluids now lack elsewhere. That will, of course, affect physiological processes. And it's most likely the outcome of cirrhosis. So additional causes may include heart failure, constrictive pericarditis, abdominal cancers, nephrotic syndrome, and malnutrition. You can see that 25% will die within a year if it has a background of cirrhosis, meaning liver problem, decreased albumin synthesis, and a pressure gradient change push water into the cavity. So once again, two reasons. We know already that proteins are major influencer of osmotic pressures, which are mechanical pressures, which make water or fluids move to certain areas according to the gradient, and you can see it occurring here. The new gradient also relocates lymph and bacteria into the cavity and changes the permeability of the surrounding capillary. So the whole system is starting to change, including blood vessels and lymph. And of course, bacteria means inflammation. Because of this shift, you have a hormonal imbalance, changes to blood circulation, increase nitric oxide, aldosterone, and ADH, which all are going to affect water retention. Then you see that we have plasma volume expansion occurring in a very rapid way, leading to portal hypertension. What else? And then in order to reduce the pressure and on the lungs and dyspnea, you can put someone in what we call the semi-Fowler position, which you see is a 30-degree angle compared to the full one, which is 45 degrees usually. Okay, hepatic encephalopathy is the complex neurologic syndrome that originates from impaired cerebral function at the chemical level of neurotransmitters. So you have problems with neurotransmitters leading to this situation. It's usually accommodated with a flapping tremor and EEG changes. Electrical, that can be fine. If it's secondary, obviously you have an underlying cause. that might worsen the pace that this condition is developed. You see that liver dysfunction and collateral vessels shunt blood with toxins towards the brain instead of the liver. Once again, the liver is the toxin lab of the body. Anything that a local tissue is not able to cope with is sent to the liver. In this case, you have a change of the direction of flow instead of to the liver, to the brain. Obviously, that's not going to end up very well. So you have accumulation of toxins in the brain, which alter brain metabolism, causing edema. Edema increases internal pressure, and this is not going well. Then we have ammonia, which is a dangerous gas that is accumulating and causing inflammation as well. And of course, there are other risk factors, but this is the major one. So, infection, hemorrhage, chemical therapy, and electrolyte imbalance are part of the risk factors as well. You can see that since we are affecting the brain, personality changes are definitely possible. Memory loss, lethargy, irritability, and sleep disorders. You can see that the situation can progress to confusion, flapping tremor, stupor, convulsions, and coma uh, due to liver failure that might lead to death. And these are very serious consequences to have to deal with. Talking about cirrhosis, is an irreversible inflammation of a fibrotic liver. The fact that the liver is already fibrotic makes it irreversible. Of course, it's one of the leading reasons of death in the US, but it can also be a manifestation or a symptom of other diseases at the same time. We don't know the exact mechanisms completely, and it's suspected that there are more than one. So, if you look at cirrhosis, I think that this is one of the best, so to speak, in a way, disease to summarize all the processes that we've talked about before and how they lead one after the other to worse conditions. So you see cell injury induces an immune response that untreated leads to fibrosis and scarring, the loss of function, you know this. Scarring and fibrosis alters structure, that alters function. Changes to fluid and blood vessels lead to decreased supply and disposals of nutrients and metabolic substances. We have elevated mechanical pressure. The decrease To decrease the blood pressure, new vessels are created, shunting blood from the liver, causing local hypoxia. So we have a mechanical pressure problem. If you increase the number of vessels, you divide the pressure, the same force, by greater surface area because you have more uh, um, capillaries right now, or blood vessels, but you're also leading blood away from the area. So hypoxia, of course, induces function changes and metabolic disorders, which lead to toxin accumulation, which stops regeneration of tissues and cells, leading to cell and tissue death. Does that sound familiar? Because it's once again, it's a summarization of everything, all the mechanisms that we've learned and the cascades of results. And then you have liver failure. Of course, the amount and sort of toxins determine the rate of deterioration and or healing. So you see that the toxins include alcohol that might lead to alcoholic liver disease, also known as alcoholic cirrhosis. Basically, the next slide will kind of tap into what alcohol does in a way. So when we're talking about alcoholic fatty liver, is a form of a mild form of the condition. Alcohol helps deposit fat, so that's part of the connection. Um, and it causes it in low levels, definitely in high levels. Um, High levels of fat may be perceived as a threat, leading to an immunoresponse, resulting in what we called ALD. Um, in this case, extensive cell death is replaced by immune cells, meaning that the immune cells get stuck there and stay there, and that is what leads to the fibrosis, necrosis, and scarring. Um, Once again, these are perfect conditions for bacteria and cancer to develop. Um, and then you can see that at the metabolic level, you have an imbalance or impairment of the the aerobic metabolic pathways in the mitochondria, which help induce this situation. Aerobic exercise obviously can help here. So you can see that the negative implications are basically endless. Symptoms: naturally enlarged liver, anorexia, nausea, jaundice, edema, fatigue, weight loss, testicular atrophy in men, reduced libido, semen that contains no sperm in men, and decreased testosterone. In addition, all the things that we've seen before: abdominal pain, cirrhosis, hepatomyalgia, spleniomyalgia, which is the enlargements of the liver and the spleen, ascites, GI hemorrhage, portal hypertension, hepatic encephalopathy, anemia, renal failure, esophageal varices, and of course, death. Then you see that fat can accumulate due to obesity regardless of alcohol. Um, which happens in most people that even without drinking alcohol. Then we have biliary cirrhosis, which originates from a different area, the bile ducts. It can be primary or secondary. Obviously, the primary form is has an autoimmune background and progresses rapidly within a decade or so. And this can develop, as we've seen before, to multiple threatening conditions if not treated. The secondary form is the result of usually a bile duct obstruction that leads to necrosis and fibrosis and inflammation and edema, and probably the need to surgery, the need for surgery. Okay, not much to go. Very simple situations. We're talking about on slide 151 about gallbladder disorders. They're pretty simple to follow. So gallstones are the number one cause for obstruction and inflammation of the gallbladder. If you notice, everything that we've talked about when we talked about kidney stone is going to reoccur here. So I'm going to let you read it. Obviously, the major difference here probably is the location and the content of the stones that will be more representative of the substances of the bile duct. So once again, you can see that the size depends on the ratio between the stone and the duct. It can accumulate biological substances or tissues, which makes it worse. Um, since it's stones, it means that you can have more than one. Let's see. Obviously, the bigger and stronger or stiffer they are, harder they are, they increase the pain and the injury to the environment. You might be asymptomatic at first until it grows, and then it will include pain, jaundice, vague heartburn, flatulence, epigastric discomfort, and food intolerance. Then, obviously, this can cause a great grounds for infection and inflammation. Pancreas disorders, basically, once again, very simple ideas. I didn't go in depth because I think you already know what goes on. So we can talk about the inflammation of the pancreas, can be acute or chronic. Um, it's relatively rare, but very lethal in its severe forms or cases. You can see that the acute form is usually mild and self resolving, whereas it may worsen and demand hospitalization in up to 20% of the cases. Obstruction can cause the backflow and activation of digestive enzymes, meaning that you are starting to destruct the tissues before the obstructions, um, leading to autodigestion of pancreatic cells that lead to inflammation. Of course, at some point, you're going to hit the blood stream and cause disturbances to blood flow, coagulation, necrosis, fat necrosis, and edema. Of course, alcohol always makes things worse in the digestive system, so you should um, relate to that. The chronic form is irreversible. It's mostly associated with chronic alcoholism. Um, what else? Uh, the chronic form has greater pain, greater weight loss, ischemia, uh, neuritis, and malnutrition compared to the acute one. So that's it for this system. Let me know if you have any questions, as always.